reacts to the parent, but also how the parent reacts to the child. You know, some parents can play very easily during free play. Other parents really, you can tell they've never played with their child. They don't have any idea how to do it. But then when you add the structure, some are able to play with them in a more appropriate way with structured play, and others just take over. But the relationship-based assessment helps us learn how the child, the kinds of things that the child has learned about the relationship, how secure they feel. And also, if you have a child, for example, who's been taken into care and is in foster care, we also do the assessment with the foster parent or the relative. So it gives us a feel for how to work. And in those cases, we're working with the court, helping to support permanency. But you also get to learn, you know, where the child is and what the strengths are and what the weaknesses are based on the early relationship experience. So let's just look at signs of children of different ages when their emotional needs aren't being met. That bland affect, it's really scary to see no affect. You know, you're very familiar, all of you, I'm sure, with 3 and 4 and 5-month-old babies where you get that responsiveness back and forth already. These kids show no affect, and you see it in year-old children, 2-year-old children. So that's one of the things. Lack of eye contact. Child coming in the room making no eye contact with, and this is young child or older child, but as well, no eye contact with you, no eye contact with parent, non-organic failure to thrive, lack of responsiveness, preferring a stranger to a familiar caregiver. Their little 2-year-old walks in the room now, runs up to you, runs up to you, runs up to me. We actually were doing some filming. 0 to 3 is making another DVD related to our Court with the Work. And there was a little 2-year-old who was in the room with a number of us who were strangers to him and was with a parent. This child was in care. So the first thing he did is he came up to this man sitting next to me. This man knew nothing about children, was really friendly, wanted to share his toy and smiled and all of that. He was a little under 2. Then he came to me and did the same thing. Then he went to this man over here and did the same thing. And so the person on that side who knew nothing about children said, "Oh boy, I'd like a lot of kids like that." I said, "No, you wouldn't." I said, "He's not supposed to be doing that." You know, that he never looked back to the mother. The mother wasn't a secure base for him. So I think we need to be aware of those things as we see them. Let's look at children who are a little bit older. You get we're all familiar with the dysregulation and the aggressive behavior. Lack of attachment, the indiscriminate attachment that I was talking about. Sleep problems. Someone had brought up sleep problems and sleep disorders. And what's beyond usual behavior? Now, one of the things that we know in toddlers or preschoolers, there's a certain amount of behavior that's normal. This is being a little bit redundant, but again, the parent or caregiver's problems that contribute to the kinds of difficulties that we see in children. The one that's new here hasn't been up for parents' own history of abuse and neglect. And the child-parent psychotherapy that we focus on a great deal, based on the idea of ghosts in the nursery, the idea of the parents' unresolved early childhood experiences that they play out again with their child, and then the traumatic experiences of the parent that lead to them being emotionally unavailable. And being there is one thing, but being emotionally available is very important. In school-age children, again, difficulty concentrating, problems in school, peer relationship problems, more acting out, withdrawal from school activities, and poor self-esteem. All of those are issues that come up that are problems, red flags in school age. And then in adolescence is where we get the risk-taking behavior, the very high-risk behavior, violence. You know, I don't know if we have good data on it, but the idea of dating violence and how many of those young people have been in families where there was domestic violence or exposed to other trauma, those kinds of issues. And of course we get alcohol abuse and drug abuse. And by the way, in high-risk situations, for example, after hurricanes, earthquakes, tsunamis, terrorist attacks, You know, one of the things that adolescents, if they're not able to play an active role in their community and in their family, and people are having such a difficult time, might resort to those kinds of high-risk behaviors, which is one of the reasons to think about those positive programs. So some of the other kinds of adolescent high-risk behaviors besides alcohol and drugs is eating disorders. And so many eating disorders will emerge at that point. Violating the law without concern for others. You know, it's always interesting, and you see it, for example, even something as, you know, getting caught at shoplifting. And often that can be an intentional thing. Sometimes it's a peer thing or whatever else, but violating the law, fire setting, abusing animals, and life-threatening types of things. And we certainly see in situations of teenagers who've been exposed to a lot of violence, who've been exposed to trauma, after disasters, we see a lot of that potential high-risk behavior, and it's very important. You see it under other circumstances as well. Warning signs in adolescence, and it's very important to pay attention to it, and I'm sure a lot of you have a lot of experience with adolescence. First of all, sadness, feeling of hopelessness. You know, people are taking very seriously teenagers who say, you know, I don't want to live. You know, and we've had a lot of experience in the post-disaster environment where people who've had less mental health experience go out, and both adults and children will talk about a lot of hopelessness and sadness that has to be taken very, very seriously. Being very angry, overreacting, feeling worthless, feeling guilty, worrying a great deal. And then death of someone important in teenage years. You know, obviously that's important early on, but it's also something that can have enormous impact in teen years. Fears, new fears that they didn't have before, and unexplained fears, and constant concern about physical problems or appearance. Those are all issues in adolescence. Warning signs. And the reason I'm spending a little time on warning signs in adolescence is, you know, they're really a high-risk age. I saw someone who was just 18, brought in and had significant traumatic experiences early on, and it's such a high-risk age. And I think we need to pay a lot of attention, 17, 18, 19, for mental health issues. So decline in school performance, people who had no big difficulty in school before and all of a sudden are having serious problems, losing interest in things that they once enjoyed. Unexplained changes in sleep or eating, avoiding friends or family, wanting to be alone, not completing things, staying away from things, and feeling life is too hard to handle, and obviously suicidal thoughts. And here, persistent nightmares, those types of behaviors, all those are warning signs, and I gave those to you. And I really recommend that you read this article that Ann Masden wrote about resilience as ordinary magic. And essentially, these are children or adults who are going to do okay despite really difficult circumstances, and most people are resilient. The majority of people are resilient even after very difficult traumatic experience. We've certainly learned this in the disaster environment, but in other ways. And these are some of the kinds of things. This is her short list for what contributes to resilience. A secure relationship, what I call a good enough relationship. So how many of you in the room, when you were raised, said there were things that your parents did that you would do differently if you ever had your own children? Okay. And how many of you who have children saw yourself doing the same thing with your children? Okay. Because that's what happens. So then we change it. We might do it once. Hopefully we won't do it more than once. But good enough parenting means, you know, we do our best. You know, nobody's a perfect parent. Maybe there are some out there, but I don't know. But we do our best. That's good enough parenting. Having some problem-solving skills, enough intellectual skills for problem-solving. Being able to regulate behaviors and emotions. is very important. Feeling good about yourself.